So immunity and infections. What is immunity? So immunity refers to the body's ability to prevent the invasion of pathogens. And what are pathogens? Pathogens are anything that is foreign to your body or your body identifies it as foreign. It could be your own body system's byproducts, but your body may perceive it as a pathogen. So pathogens, the body perceives it as disease causing substances, okay, like bacteria, virus, fungi, okay, parasites, okay, these all are pathogens. Even if you are allergic, something that will not cause you any harm, like dust, pollen, dust, chalk powder, certain smells, certain food. Okay. Your body may perceive that as pathogen as well. And it can give you allergic reactions. Okay. So people are exposed to bacteria and virus on a day-to-day basis. Okay. But only few of them are pathogenic enough to cause diseases. Okay. So your immune system is made up of different organs, cells, proteins. Okay. They all work together. So each part of the immune system will see the type of immunity. Okay. There are two major types of immunity: innate immunity or natural immunity, and acquired immunity. Innate immunity, you are born with it. Okay. Even a newborn baby is born with an innate immunity. Acquired immunity is as you grow up. Okay. Your body has been exposed to different circumstances, environment. Okay. Slowly it develops an immunity against certain disease conditions. Okay. Like people who are in the clinical field, who are engaging with patients on a daily basis, hospital workers, healthcare workers. Okay. Their immunity is different from a regular person. Okay. People who work in hospitals, they usually don't fall sick because their immunity has adapted itself so well that every day they are seeing sick patients. The hospital environment also carries a lot of pathogenic bacteria and viruses, so body automatically it resets itself. The body's immunity of healthcare workers will reset in such a way that this additional exposure of pathogens don't cause them any problem. So that is also another kind of adaptive immunity, just a basis of on professions. Okay. So innate is what is natural, you're born with it. It's non-specific, which means it will attack all the pathogens in the similar way. It does not have a selective approach to kill. It has a different approach to kill bacteria. It has a different approach to kill virus. No, it's not like that. It is non-specific. Okay. The bullet that it will use to kill bacteria, it will use the same bullet to kill virus. That is non-specific immunity, natural immunity. You're born with it. Okay. Acquired or adaptive is you learn how to fight with specific pathogens. Okay. The blows that you will use on bacteria will not be the same blows that you will use on virus. Okay. You will have different tactics to bring down your different kind of enemies. Okay. So that is adaptive immunity or acquired immunity. So innate immunity, it's the general protection that a person is born with. Okay. Like even your physical barriers, everyone has skin, everyone has body hair. Okay. So that is your defense mechanism. Your saliva, everyone has saliva, everyone has hydrochloric acid in their stomach. You are born with it. Okay. Inflammation is an immune response. I have explained this earlier also. If you scratch yourself, okay, just scratch your skin inside your on your forearm, okay, inside of your forearm, that soft area, just scratch it few times. What you will see, you will see it turning red. Okay. You will see exactly how your nails have scratched it. You will identify the mark, it is red. Okay. You will feel slight heat in that area. Okay. You will feel a tingling sensation. Since you are purposely scratching yourself, it is not causing you pain, but by mistake, if somebody scratched you, it will be painful. Okay. So there will be pain, tingling sensation, redness, increase in the temperature. Okay. So this is inflammation. Okay. This what you see right now, if you have scratched the skin of your forehead, the difference that you see between the scratched area and the other normal part of your area. This is what inflammation is. Okay. So internally also inflammation can take place. Pathogens can cause the same kind of inflammation internally. Inflammation over inflammation, it will turn into a wound, it will turn into a disease. Okay. So this is what inflammation is. So this type of immunity is non-specific. Okay. Although the immune system does not know exactly what kind of antigen is invading, as I mentioned earlier. Okay, your body does not know, are you breathing in a bacteria or are you breathing in a virus? Okay, non-specific immunity will treat all with the same kind of kick and blows. Okay, it will, like, for example, the mucus that you have, okay, in your throat, in your trachea has mucus secretions. It is supposed to trap pathogens. It is supposed to trap dust. It will not differentiate between, if it is a dust particle, I will use more mucus. If it is a bacteria, I will use less mucus. It does not differentiate. Its only job is to trap the things that are pathogenic. Okay, so it is non-specific. So it will respond quickly to defend your body against any pathogen. That is innate immunity. And it's a long-term immunity. Okay. Even till your last breath, your body will be having acid in the stomach. You will have skin on your body. You will have body hair. Okay. Your body will have the immune response of inflammation if there is any attack. Okay. You will be having saliva. Okay. Even you get old, you are close to your death, this innate immunity is still present. Okay, it is a long-term immunity. Okay, in which your body is also producing antibodies on its own. So in innate immunity, cells are non-specific. They respond very fast within minutes or hours. Okay, and there is no memory. Okay, even today you got a bacterial infection. Okay, to next month also you get the bacterial infection. The innate immunity does not remember that last month also you got this infection. Innate immunity just knows to tackle the bacteria. Okay, so it does not remember, I will use the this tactic of tackling the bacteria because I know how to fight it from the previous attack. Okay, it does not have any memory like that. Okay, so that is innate immunity. So the cells that are available for innate immunity to fight back, you have monocytes, macrophages. These are different names of the cells. Okay, these are part of your immunity system. Natural killer cells like T cells, dendritic cells that are present in your central nervous system to protect your neurons. Okay, eosinophil, basophil, neutrophil. These are different types of WBCs, white blood cells. Okay, monocytes, macrophages. Okay, mast cells. These are present in your blood. Mast cells are present in your skin. Okay, and other parts as well. So these are the cells involved in innate immunity. So types of barrier, all type of barriers that you have in your body that protects your body against pathogens, they are innate immunity. Okay, so what are the different types of barrier immunity that you have? So you have physical barrier, which includes your skin, it's a physical barrier, your body hair, okay, nostrils, like if you look into your nose, you have nose hairs, okay, that is the nostril hairs. And then cilia, which is present in your trachea. These are also finger-like cells, long finger-like cells. They move in waves. Okay, your eyelashes. Okay, that can protect your eyes from dust. And in the respiratory tract, mucus secretion, GI tract mucus secretion, and acid secretion. Okay, they all are first line of defense in your body. Okay, your skin acts as a physical barrier. Because you have skin, your internal organs, everything is protected. Okay, the mucus coating in your nose, the earwax you have in your ear. Okay, these all are protective barriers which will trap the pathogen before it gets inside. Then physiological barriers. Okay, it works more on enzymatic action, certain chemical reactions. Okay, like saliva in your mouth, the tears that you have in your eyes. Okay, they all are antibiotic in nature. Not saliva is not a very strong does not have a strong antibiotic property, but since it has an enzyme of salivary amylase, okay, it can tackle some of the bacteria. Okay, that does not allow the growth of pathogens. So that is the reason why your mouth is moist. Your mouth has a humid environment. It is always moist. And humid environment is the best kind of environment for bacteria and pathogens to grow. But nothing pathogenic grows in your mouth because saliva has a innate property of being antibiotic in nature. Okay. Then you have cellular barriers like leukocytes, your white blood cells, neutrophils, lymphocytes, basophils, eosinophils, monocytes. Okay, these all are cells present in your blood and different tissues. Okay, they act as a barrier. They are quite big cells. Okay, size wise also they are quite large. They are big in number and they can intimidate the bacteria and virus. Then you have cytokine barriers in case if there is a viral invasion. Okay, automatically the invaded cell, a cell which is attacked by a virus, this cell which got attacked, it will secrete certain proteins called interferons. Okay, and this interferons will kind of form a coating around the infected cell in such a way that virus has entered the cell and it is going to destroy the cell, but it should not spread further into other cells and destroy those too. Okay, so that is a function of interferons secreted by cells when they are being attacked by a virus. A coating will be formed around the attacked cell in such a way that it will prevent the cells around it from getting infected. So this is the cytokine barrier. Okay, this is also a kind of barrier. Interferons is a barrier. Okay. So far, is it clear to all? So next is the cells involved in innate immunity. So you have phagocytes. These circulate through your body and they look for any foreign substance. Okay. And they can completely engulf and swallow and destroy whatever pathogens come in their way. Okay. These are phagocytes. Phago means to swallow, to engulf. Okay. So phagocytosis is also a process in which phagocytes are the cells that can swallow. Phagocytes are the cells that can swallow, engulf. Okay. So they will just form a hand kind of a situation, pull the bacteria or pathogen within them. Okay. Enclose it completely, secrete lysosomes. Lysosomes can break down the protein in bacteria and the bacteria or virus is dead. Okay. That is phagocytosis process. Okay. Macrophages, they have the ability to move across the walls of circulatory system, which means they may be in the blood circulation, inside the blood vessels. Okay. As soon as they get the signal from that cytokines have sent a signal, okay, a virus has invaded, macrophages will slowly move out of the blood circulation, move through the blood vessel wall, get into the area where cleaning has to be done. Cleaning means killing of the virus or bacteria has to be done, and they will move towards that cell, okay, where cytokines are signaling, come here, we have an invader here. So macrophages will stop in the blood circulation, move out of the blood circulation, come out of the blood vessel, move towards the cell which is affected, and it will start its process of killing the bacteria. So that is how macrophages work. Okay. Then mast cell, these are important for healing wound and again defense against any infection. Neutrophils, they have granules that are toxic in nature and kill pathogen that comes in contact. If you see here, even eosinophil, mast cell, basophil, okay, they all have this. See, neutrophil also, you will see the small dots. Okay, this is the nucleus. Okay, the pink that you see inside the cell, the pink color that you see in all these cells, this is the nucleus. Okay, but in the remaining part of the cell body, if you see, there are small granules. Okay, these granules are very toxic in nature. Okay, as soon as as soon as any bacteria or virus comes in contact with this cell, okay, they release these granules and finish the bacteria. Okay, so that's how neutrophils function, or any granulated WBC, granulated white blood cells. That's how they function. Then eosinophils, they are also the cells, highly toxic. They also have granules, which are highly toxic proteins that can kill parasites as well when they come in contact. Okay, so that is eosinophils. Usually, when you have any allergic reaction and when you do the blood test, you will find the eosinophil rate is quite high. Okay, which means it shows that you are suffering from some allergy or inflammation. Basophils, they also attack multicellular parasites. Okay. Do you think bacteria and virus are multicellular? Are bacteria and viruses multicellular? No, they are not. They are single cellular. Okay. Amoeba, fungi. Okay. This bacteria, virus, they are single cells. Okay. But basophils, they can kill multicellular parasites like tapeworm, etc. Okay. They parasites have certainly have more than one cells. Okay, they have a very complex structure as compared to bacteria and virus. Bacteria and viruses, they have relatively simple structure. Okay, they also release histamine. Histamine is released when you have this thing, uh, any any allergy conditions, you will be releasing histamine. Okay, so that's why during allergies, you have to take antihistamines that will suppress the secretion of histamines. Then you have natural killer cells. They stop infections by destroying the infected host cells. Okay. Viruses are, they are non-living entities when they are outside a living organism. Okay, but they get activated when they are inside the living organism. Okay, they get more power when they're inside a living being. Okay, but as soon as they're out in the atmosphere, you have a viral fever infection, you sneeze out. Okay, as long as the virus stays in the atmosphere, they become ineffective. Okay, they are just very lightweight dust particles. So all the and the dendritic cells, these are located in your central nervous system. Again, they can sense infection and send a message to the rest of the immune system that come here an infection is there. Okay, and they are very responsive, the dendritic cells, because it has to prevent any damage to the central nervous system. Central nervous system, the neurons are like very sensitive. Okay, you damage the neurons, they cannot recover. Okay, they can, or even if they're recovering, they cannot recover to its full potential. Okay, so its neurons have to be very careful. So dendritic cells are just present to give the signal to all these other cells in the innate immunity that you have to come here some infection or antigen is present. Okay. So is it clear to all regarding the cells that function in your innate immunity? Then you have acquired immunity. Okay. or adaptive immunity that your body acquires or gains over time. And unlike innate immunity, it is not present in you by birth. Okay. So the ability of the immune system to adapt itself to diseases and to generate pathogen specific immunity is called acquired immunity. Okay, so this has to first expose itself to certain infection. Only then specific antibodies can be produced by the body. Okay, so our body starts producing antibodies to engulf pathogen and destroy its antigen, but it has to see what an infection is, what kind of infection is. Only then it can make antibodies responsive to that antigen. Okay, so when it encounters for the first time, it is called a primary response. Okay, when you are encountering an antigen or a bacteria or a pathogen for the first time, it's called primary response. Once the body is getting used to these pathogens, you already have the memory of this antibody, already have the memory of the response that you have to give. So antibodies are readily available to attack for the second time. It does not take a long time for your body to attack the pathogens for the second time. Okay, this is called naturally acquired immunity. Okay, so the features of acquired immunity: ability to differentiate between different types of pathogen. Is it harmful or not? And devise different ways to destroy it. Okay. For example, viral infection, bacterial infection, these are treated differently. Acquired immunity has a different way, strategy of attacking, okay, or combating with different types of pathogen. Okay, not like innate immunity. Innate immunity just have one way of attacking and it uses the same situation, same attack for all the pathogens. But acquired immunity is much more complex. Okay, it has different strategies to uh, attack different types of pathogens. Then diversity, it can detect vast variety of pathogens from protozoa to viruses, different types of pathogens from different species it can detect and attack. It can also differentiate between self and non-self. Ability to identify that this is our own body cells and these are foreign cells. Okay, so usually when you suffer from autoimmune disorders, your acquired immunity is kind of acting up. Okay, it is not functioning properly. It loses its this feature to differentiate between self and non-self. So that's how in autoimmune diseases, acquired immunity or even your innate immunity can go on attacking its own cell. Okay, it forgets the ability to differentiate between own cells and foreign cells. Then it has memory. Once it has encountered a pathogen, it will activate the immune system to destroy it. But it will also remember what kind of antibodies were released to destroy those pathogens. And that is the memory that the body will have till its end. Okay. So that the next time, even if the bacteria enters or virus enters, the similar procedure will be followed by the body to eliminate it. So that's why you get chickenpox once, okay? The chances of getting chickenpox the second time is very rare. It happens in some individuals, it happens, but the chance of getting chickenpox for the second time is very close to zero, okay? The probability is very close to zero. So that is the memory of acquired immunity. Okay, once you have smallpox, chickenpox, okay, you will not suffer from it in the future. Then cells involved in acquired immunity: B cells and T cells. B cells can attack invaders outside the cells. T cells can also attack the invaders as well as it attack the infected cells as well. Okay, it can attack both. So B cells, why we call them B cells, they are developed in bone marrow. Okay. So these cells get activated on their encounter with foreign agents And these foreign agents act as foreign markers. Okay, foreign agents means pathogens, bacteria, viruses. Okay, so once the B cells are always running in your circulation, okay, as soon as they encounter something that is pathogenic, they get activated, and immediately uh, they form themselves into plasma cells. Okay, and once the B cells form plasma cells, that's when antibody production will begin. Okay, because B cells, without seeing what the antigen is, without getting an encounter with an antigen, B cells will not know what exact antibodies it has to produce that can tackle those antigen. Okay, so an encounter with an antigen is required for B cells to start working. Okay, so once the B cells become plasma cells, they can produce antibodies, which based on their encounter, they know which kind of antibodies has to be produced. Okay, and once the antibodies are released, they attach themselves to the antigen. Okay, they fit together. It's like a puzzle. Okay, antigen is a puzzle piece, and its perfect fit is the antibody that the B cells will make. Okay, so only if the B cells have seen this puzzle piece, okay, the B cells have encountered this antigen puzzle piece, it knows how to shape the antibodies. Okay, how to shape the antibodies, and which type and which shape, which size of antibodies has to be released, okay, to tackle this antigen or to solve this puzzle. Okay, so the antibodies detect any antigen in the body and they destroy it. So the immunity dependent on this B cells is called humoral immunity. The way how B cells see the antigen for the first time, then make an antibody, release it. The way how antibodies go and attach themselves to the antigen. Okay, this entire process is called humoral immunity. Okay, whereas the T cells, they originate in the bone marrow, but they develop in the thymus gland. Okay, so we have a limited number of T cells. Your body cannot keep producing T cells over your lifetime. Okay, in your childhood and even in your early teenage years, how much ever T cells your body was able to produce, that's it. That's the amount of T cells you have to work with throughout your life. Okay, so usually what happens in AIDS, HIV positive patients and all, okay, who suffer from AIDS, HIV positive, the HIV virus, okay, human immunodeficiency virus, they go and attack these T cells. Okay, you have a limited number of T cells, and those get destroyed. That's how the AIDS syndrome will start. Okay, acquired immunity deficiency syndrome will start. Okay, it's a syndrome, it's a group of diseases that come together. Okay, so that's the pathogenesis of AIDS. Okay, these are the T cells that get completely destroyed by the HIV virus. Okay, so you will produce, like if you are an adult, you already have specific amount of T cells produced in your body, and you have to work with that throughout your lifetime. Okay, whatever infections you go through in your future, you have to work with that. So T cells, they can differentiate into helper cells. Okay, B cells can differentiate into plasma cells. T cells can differentiate into helper T cells. Okay, or cytotoxic cells. Cytotoxic cells means cyto cell. Toxic means killing. Okay, so that's why if you remember here, if you remember the previous slide, T cells can attack infected cells, which means what? T cells are cytotoxic in nature. They can kill the cell completely. Your own human body cell, which is infected, okay, which has a bacteria or virus inside it, T cells will go there and it will destroy the entire cell along with the bacteria and virus inside it. So it is cytotoxic in nature. Okay, so that's a feature of T cells. It can either become helper T cells, or it can become cytotoxic cells and regulatory cells. Okay, so these are the different types of T cells that are released into the bloodstream when they are developed. So when these cells are triggered by an antigen, helper T cells will release cytokines that act as messengers. Okay, and these messengers will bring the B cells Okay, these the cytokines that the T cells have released, they are the messengers. They will go and bring the B cells where an infection is. So this is where the B cells will encounter the antigen for the first time. And now the B cells will know what kind of antibodies they have to make. Okay, so both of them, they work together to show each other. Okay, it's like T cells are like a small tiny messenger cells. They're holding B cells and showing, see, this is the person who is harassing us. Now B cell has seen the person who is harassing, and the B cell will take action to tackle that harassment. Okay, so this is how the storyline goes. And cytotoxic cells, T cells, are capable enough to kill cancer cells also. So your body also has its own reset system. Wherever cancer is developing, if you have a good amount of T cells, a stable amount of T cells, your body can kill the cancer cells in the initial phase, preventing you from getting cancer. Okay. The regulatory T cells, they regulate your immune reactions, which means do not attack your own cells. Stick to the cells who are invaders. Don't attack your own cells. Don't become autoimmune. So that's the function of regulatory T cells. Okay. So that's how B cells and T cells function. Is it clear to all? In children, ART, antiretroviral therapy, works better because they still have an active thymus gland. Because there was a case in London, I guess, a very young child, 2 or 3 year old child, was completely cured of HIV. Okay, few years back, if you have noticed the news. So types of the child who was cured from HIV was a newborn, I guess. Okay, and the child was born to an HIV mother, something like that. And since birth, when it was detected, the child was put on antiretroviral drugs, okay, for 1 or 2 years. And then it was seen the viral copies came down really well, so that the child does not no longer produces the viral copies of HIV. Okay, that was the last we saw of the news, but we don't know right now. But yeah, a few years back, this happened in London. Okay, so that's a sign that antiretroviral therapy, which is used in AIDS. Okay, it cannot cure AIDS, but it's used to symptomatically manage the AIDS situation, HIV situation. So it works better in children. So types of acquired immune response. You have humoral response and cell-mediated immune response. Humoral response, we just explained about how B cells have to see the antigen, then it can make the antibodies. Okay, so that is humoral response. So this is the diagrammatic representations on how humoral response work. Okay, so you can see here a B cell that is triggered. How is it triggered? Because T cells have sent the message. Okay, helper T cells have sent the message that come here. Helper T cells are triggering the B cells, come here, there is an invader. Okay, so a B cell that is triggered when it encounters the matching antigen. Okay, it has, see this small flower you can see. Okay, that's take yellow flower, you understand that as an antigen. Okay, so the B cells will engulf the antigen, digest it. Okay, and you can see it has digested the flower. Now the petals are completely disintegrated. Okay, so now what is the purpose of breaking it down? For example, if you want to see how a certain device is engineered, you have to open it up, right? You have an equipment. Okay, you want to see how it functions from an engineering point of view. If you want to see, you have to take the screwdrivers, open the device up and see what kind of systems they have put in. Okay, so the same thing is happening in B cells as well. It will require the antigen. It has to break down the antigen and study, okay, this is what the antigen is made up of, so I can make this kind of antibody to tackle this antigen. Okay, so the breakdown is required. Okay, so it is the B cells is able to display the antigen. Okay, based on its unique MHC molecules. MHC molecules and all these are medical terminologies. Okay, it's major histocompatibility complex. These are the full form of MHC. You don't have to study about it, but understand how the B cell functions. Okay, so based on the complex that the B cell has studied, it will make an antibody so specific to this antigen. Okay, based on what the B cells have studied, it will start releasing an antibody so specific to this antigen that the antibody will not work on any other bacteria or virus. It will go and search this specific antigen which is present in the rest of your body and tackle it. Okay, so that is what's happening here. The B cells, they take the help of the mature T cells. Okay, and both of them with each other's help, they will produce the antibodies. You can see this antibodies, Y-shaped antibodies being released. Okay, and this will go and attack and tackle find out the antigen wherever it is present in your body, tackle it. Okay, so this is the humoral response. So in cell-mediated response, here cells are involved. Okay, your normal body cells are involved. So this response is initiated by the helper T cells. Okay, whenever the cells get attacked by any virus or bacteria, we have seen earlier, okay, a barrier response will be released. Cytokines will be released. Interferons will be released. Okay, and this is enough for the T cells and the B cells to get triggered, to get the message that something is happening here. Okay, so cell-mediated immunity is initiated by the helper T cells. So cytotoxic T cells will immediately come here. Okay, it will take out the entire cell. It will not wait for the bacteria to come out and cause more infection. It will kill the entire cell which is infected, thereby killing the bacteria or virus which was inside it. Okay, and it has some very potent toxins. These T cells, cytotoxic T cells, they have very potent toxins within them which can kill the cell. Okay, so that's how they promote apoptosis. Apoptosis means cell suicide, we can say, or it is a cell death. Okay, apoptosis means either it is cell suicide, cells can kill themselves, that is also apoptosis, or it's a programmed cell death, targeting that particular cell, not causing any harm to the nearby cell. Only one cell will be targeted, okay, and that will be killed. So that is also apoptosis. Okay. So this is a cellular response or a cell-mediated response because cells are involved here. The infected cells are involved here. In humoral response, infected cells are not usually involved because if the B cells just requires the pathogen that is causing the infection. B cells don't have to look what kind of infection it is caused or where or what cells are involved. B cells does not need that information. B cells only need the pathogen so that it can produce an antibody to fight this pathogen. That's it. Okay. But in cellular response, cells get triggered. They release certain chemicals, cytokines. Cytokines will trigger the T cells to come here and destroy the cell. Okay. Cytokines will also call helper T cells to bring the B cells, show this antigen. and let them produce antibodies. Okay, so this is how the entire mechanism takes place. So acquired immunity that develops you during your lifetime, that also has further types. It has active immunity and passive immunity. So active is your own body is making the antibodies. Okay, your own body will make the antibody, but you need exposure. And exposure can be natural or exposure can be artificial. Okay, for example, you are born, okay, you don't have active immunity yet, but you are exposed to your environment. A newborn child got some infection. Okay, naturally the child was admitted in the hospital, or from the hospital or from the home, the child got an infection. The child's body will start producing antibodies. That is a natural way. Okay, artificially, how you will give the infection? You will inject vaccines. Okay, vaccines are virus that you are injecting. Okay, so you don't want the disease to happen, so that's why you're giving live attenuated viruses. So they are viruses enough, they which have enough information for the B cells to make antibodies, but they are not strong enough to cause the disease. That is the live attenuated viruses vaccination. Okay, so artificial, that is also natural and artificial. Artificial is the vaccines that you get. Natural is the naturally when you're living, you get infections. Okay, you are exposed to infections, you get cured on your own. That is natural way. Now, passive immunity, it is passed down to you. Passive immunity, it is passed down to you. Okay, so this also develops after you receive antibodies. Somebody has made antibodies in their body and they are giving you their antibodies. Okay, in active immunity, nobody is giving you antibodies. Environment is giving you infection. Vaccine is also giving you infection. Your body has to produce the antibodies. Okay, but this is spoon feeding. Passive immunity is kind of spoon feeding, that somebody has made antibodies and you are just taking the antibodies. You don't have to work with the infection here. Okay, so breast milk, breastfeeding the child. Antibodies from the mother is given to the child through breast milk. Okay, so mother's body has already made antibodies and she is giving it directly to the child through breastfeeding. That is a natural way. Breastfeeding is natural process. Okay, artificially also you can get somebody's antibody, that is through injections, immunoglobulin injections. It's not vaccination, it is immunoglobulin injections. Okay, so antibodies are synthesized in the laboratory. Okay, it is transformed into injectables. Okay, immunoglobulin injections, and as a part of your universal immunization also you will get certain immunoglobulin injections. Okay, so directly you are getting antibodies given to you. So that is an artificial passive immunity. Okay, is the classification clear to all? Next, you have autoimmunity. Sometimes your own immune system attacks its own cells and organs instead of foreign agents. That is called autoimmunity. Okay. Type 1 diabetes is an example of an autoimmune disease. Okay. So here, not just B cells, T cells can also trigger autoimmune situation. Okay. Bone marrow develops your B lymphocytes, B cells. The thymus gland develops your T lymphocytes, T cells. Okay. Both can go and attack your own body and cause an autoimmune disease. Vaccines are made up of antigens of pathogens, okay, that cause a disease. And vaccinating a pathogenic microbe or virus into your body, it deliberately produces a similar response, but not the disease condition. Okay, vaccines are supposed to create an infection kind of a response in your system, but it should not give you signs and symptoms of a disease. Okay, so that's why only half potent viruses are injected. And immunization is the process of providing resistance to a pathogenic microbes and other infectious diseases by administering vaccine into your body. Okay, and vaccines, it can stimulate, it will provoke your body's immune system to protect itself Okay, it will trigger your own immunity to go and produce antibodies for future use. Okay, that is the use of vaccination. Then you have the immune system, that is, or your lymphoid system, lymphatic system. Okay. So these are the, you can see in this image where all you have your lymph nodes. Okay. Spleen is also a part of your lymphatic system, thymus gland, which becomes inactive later on in your life. Okay. Your bone marrow, you have lymphatic vessels. Peyer's patches are the lymph nodes or lymphatic organs found in your intestine that protects your abdominal region. Okay, you have a lot of lymph nodes in your uh, underarm. Okay, the underarm region. Okay, there is also a lot of lymph nodes under your jaw. Okay, behind your salivary glands, in your groin region. Okay, you have lymph nodes to protect your extremities. So lymph nodes are present in these specific areas to protect you from, to produce lymphocytes and protect you from infections. Okay, so these are the lymphoid organs that are supposed to defend your body against pathogens. Okay, and also the spread of tumors. So bone marrow, blood vessels, lymph nodes, lymphatic vessels, thymus gland, spleen. Okay, these all are clusters of lymphoid tissues present, spread throughout your body. Okay, they're always vigilant. They are very vigilant towards any minute infections. And lymphoid organs are the site of origin, maturation, and proliferation of lymphocytes. B lymphocytes, T lymphocytes. From where do they produce? They originate. They originate from the lymph nodes. They originate from the lymphoid organs. Then they go to the bone marrow. Then they go to the thymus gland to get developed and then be secreted into the bloodstream. Okay. So they exist in the primary, secondary, and tertiary areas of during their entire development and maturation. We will see that. And the highest percent of lymphocytes are present in the white blood cells or leukocytes. Your white blood cells are also produced from the lymph nodes. So primary lymphoid organs, they just produce the lymphocytes and they allow the maturation of lymphocytes. Okay. So they have a lot of immature and proliferated lymphocyte cells. Okay. And examples are your thymus gland and your bone marrow. Okay. Secondary lymphoid organs, they are the promoting sites for the interaction of lymphocytes with antigen. Okay. These are the areas where antigens will be trapped and the lymphocytes will come, study it, make the antibodies. Okay. So they initiate the adaptive immune response. Okay. And because of this, this secretory lymphoid organs, you have your acquired immunity. Okay. This is the areas where whatever antigen or whatever pathogen is causing harm to you, they will be trapped. Lymphocytes will come here, study it, destroy it. Okay. Make antibodies and protect your body. Examples, your spleen, tonsils, lymph nodes, wherever it is present, appendix, Peyer's patches. So these are secondary lymphoid organs. So tertiary lymphoid organs, they have very less amount of lymphocytes, but during inflammation, they have an important role. So including tumors and inflammatory stimulation, okay, these tertiary lymphoid organs, they are active. Okay. Peyer's patches and also comes under tertiary lymphoid organs. So that's all for today's session. If you have any queries, you can mention in the chat box.